All right, so this is my pharmacology presentation of the 26 drugs. So first, I'm going to do the bronchodilators. So the first set is the adrenergic bronchodilators, which dilate the bronchial airways by relaxing the muscles that are surrounding the airway. So first we have albuterol, which is probably the most known bronchodilator. The brand names are Proventil and Ventolin. It selectively stimulates the beta-2 adrenergic receptors and relaxes the smooth muscle in the airway. This is used to treat and prevent bronchospasms in patients with reversible obstructive airway diseases like asthma, for example. Some contraindications, there should be caution used if the patient is hypersensitive to the drug or the components of the drug. Side effects can include tremors, insomnia, nervousness, and hypertension. The dose and frequency is 0.5 milliliters every 4 to 6 hours, which is for a small volume nebulizer, and then 2 puffs every 4 to 6 hours, or 1 puff every 4 to 6 hours, which is a MDI, and that's just all based on the doctor's recommendation for the patient. And the patient should begin to breathe more effectively after taking this. Next is levobuterol. The brand name is Xopenex and Xopenex HFA. It is the same as albuterol, and it stimulates the beta-2 adrenergic receptors and relaxes the smooth muscle in the airway. It prevents bronchospasm in patients with the reversible obstructive airway diseases. The contraindications is hypersensitivity to levobuterol or racemic albuterol. The side effects include nervousness, tremors, and headache. The difference between levobuterol and albuterol is albuterol has a risk of tachycardia and levobuterol doesn't. So if a person is already tachycardic, you would give levobuterol instead of albuterol because you don't want to risk increasing their heart rate even more. The dose and frequency of this one is a 3 milliliter dose 3 times a day, or 2 puffs every 4 to 6 hours. And those are delivered through small volume nebulizer and meter dose inhalers. And after taking this medication, the patient will have better test results, such as pulmonary function testing and physical improvements in their breathing. Next is racemic epinephrine. Brand name is epinephrine and micronephrine. This stimulates alpha and beta adrenergic receptors, reducing the mucosal secretions and relaxing bronchial smooth muscles. Indications, it relieves the symptoms in asthma patients and used for pediatric patients with croup. Contraindications is hypersensitivity to the drug and components of the drug, heart disease, or a seizure disease. Side effects include tachycardia, hypertension, nausea, and vomiting. The dose and frequency is 0.25 or 0.5 milliliters as needed. And the form of delivery is a small volume nebulizer. And the benefits, they relieve the symptoms in asthma patients. Next is salmeterol. The brand name is Ceravent and Ceravent Discus. This also relaxes the airway smooth muscle. It's indicated for patients with persistent asthma and COPD. The contraindications include hypersensitivity to the ingredients of the drug. Side effects are nasal congestion, migraines, dizziness, and tremors. The dose and frequency is 2 puffs twice per day or 1 blister twice per day, and those are delivered through meter dose inhaler and dry powder inhalers. And it is an asthma maintenance drug, so it will reduce the symptoms, but it'll reduce the occurrence of symptoms. Next is arformoterol. The brand name is Brovana. It stimulates the beta-2 adrenergic receptors and relaxes the smooth airway muscle. It's indicated for treating bronchoconstriction in patients with COPD. The contraindications include diabetes, seizures, and thyroid toxicosis, which is increased thyroid gland activity. Side effects include tremor, nausea, vomiting, and diarrhea. Dose is 1 vial twice per day, and the form of delivery is through a small volume nebulizer. And it is a COPD maintenance drug, and it helps prevent symptoms. Next is formoterol, which is Performist, as the brand name. The same goes for this one. It relaxes airway smooth muscle. It's for COPD maintenance. Contraindications are thyrotoxicosis, diabetes, and hypertension. Side effects are nervousness, headache, dry mouth. The dose and frequency is twice per day. The form of delivery is 20 micrograms by small volume nebulizer, and it prevents and reduces COPD symptoms. Next is theophylline. I could not find a brand name on this one, but the mechanism of action on this one is smooth muscle relaxation and suppression of the response of the airway stimuli. Indications include bronchospasms, apnea, and asthma and COPD exacerbations. Contraindications include hypersensitivity to the components of the drug and an allergy to corn-related products. Side effects include tachycardia, nausea, abdominal pain, and restlessness. The dose and frequency is 400 milligrams per 250 milliliters. You deliver this one through a small volume nebulizer, and it reduces the asthma and COPD symptoms. Next, we have the anticholinergic bronchodilator, which blocks the parasympathetic nerve reflexes that cause the airways to constrict to allow the air passages to remain open. So first, we have tiotropium bromide. The brand name for this one is Spiriva and HandiHaler and Spiriva Respimat. This one works by blocking the mucocinin receptors in the airway smooth muscle. The indications for this one are patients with COPD and asthma. Contraindications are hypersensitivity to the drug and its components. The side effects include upper respiratory tract infection, dry mouth, and sinusitis. The dose and frequency is 2 inhalations daily and then 2 puffs daily, which the inhalations is for a DPI, and then the slow mist DPI is the puffs. The dry powder inhaler is going to be an 18 microgram capsule, and the slow mist dry powder inhaler will be the 2.5 micrograms per puff. This maintains asthma and reduces the risk of asthma exacerbations. Next, we have adrenergic and anticholinergic combination. So this is just a mix of 2 types of bronchodilators. It's ipratropium bromide and albuterol. The brand name on this one is Convivent and Duoneb. This produces bronchodilation. The ipratropium bromide produces bronchodilation, and the albuterol relaxes the airway smooth muscle. Indications are COPD and asthma exacerbations. So this is going to be used during a asthma or COPD episode if they are in the ER struggling to breathe. Contraindications include the hypersensitivity to the drugs and their components, because there are different indications for each drug. The side effects include sore throat, chest pain, and constipation. The dose is a 3 milliliter dose delivered by a small volume nebulizer, and that is 0.5 milligrams of ipratropium bromide and 2.5 micrograms of albuterol. And this just reduces COPD and asthma symptoms and helps the patient to breathe easily during and recover from an exacerbation. Next group is corticosteroids. This is a group of steroid hormones produced in the adrenal cortex or made synthetically. So first we have budesonide, which is the brand name is Pulmicort Flexhaler. It inhibits multiple inflammatory cytokines and produces multiple glucocorticoid and mineralocorticoid effects. Indications include asthma, bronchopulmonary dysplasia, and croup. Contraindications are compromised liver function and pulmonary tuberculosis. The side effects include mild throat irritation, respiratory infection, and oral candidiasis. The dose is 2 puffs twice a day, and it's delivered by a DPI, which can be either 90 or 180 micrograms per puff. It prevents the difficulty breathing, wheezing, and coughing in asthma patients. All right, next is the fluticasone propionate. The brand name for this one is Flovent. The mechanism of action, it inhibits multiple inflammatory cytokines and produces multiple glucocorticoid and mineralocorticoid effects. Indication, it's for asthma patients to maintain their asthma. The contraindications is status asthmaticus. So that's basically saying if they are in the ER having an asthma episode, you do not administer this medicine, because it is a long-acting medication, not a short-acting. So this is strictly for maintenance. The side effects include adrenal suppression, posterior subscapular cataracts on prolonged use. The dose and frequency is 2 puffs 4 times daily, and it's delivered by an MDI, which can be 44, 110, or 220 micrograms per puff. And this prevents asthma episodes and asthma symptoms. Next is Deltazone, which the brand name is prednisone. This decreases inflammation via suppression of the migration of polymorph nuclear leukocytes. Indications include arthritis, blood disorders, severe allergies, asthma, and COPD exacerbations. Contraindications include congestive heart failure and tuberculosis. Side effects are nausea, heartburn, headaches, and dizziness. The dose and frequency is 5 to 60 milligrams per day. That's just based off the doctor's prescription. And the form of delivery is an oral tablet. This helps patients, they experience less pain and swelling, and it helps calm the airway inflammation. Next is mometasone. The brand name is Asthmanex. It inhibits the inflammatory cytokines as well and produces the multiple glucocorticoid and mineralocorticoid effects. The indications is for asthma maintenance. So just like the last one, the contraindications is status asthmaticus and bronchospasm. So that's if they are having a current asthma episode, can't breathe, they need to reach for their short-acting inhaler like albuterol instead of this one, because this one is strictly for maintenance. The dose and frequency is going to be 1 or 2 inhalations daily. Again, that's just up to the doctor on what they've prescribed, and it's a dry powder inhaler, so that's going to be 110 or 220 micrograms per puff, and it just reduces the asthma symptoms. Next, we have a corticosteroid and adrenergic combination. So this one is the fluticasone and salmeterol, and the brand name on this one is Advair. And it's a bronchodilator that also prevents the release of substances in the body that can cause inflammation. So this is used in asthma and COPD patients to maintain their symptoms. Contraindications include diabetes, hypertension, and thyrotoxicosis. Side effects are upper respiratory infection, throat infection, headache. This is normally 1 puff twice a day in a dry powder inhaler, and it's going to be 100 micrograms of fluticasone and 50 micrograms of salmeterol. And it prevents and reduces asthma and COPD symptoms. Next, we have the budesonide and formoterol, which the brand name for this one is Symbicort. It reduces and prevents respiratory tract infections while decreasing resistance in respiratory airway to increase the airflow to the lungs. So this is indicated for asthma patients to maintain their symptoms and to help them breathe. The contraindications are diabetes, tuberculosis, liver problems, and hypertension. The side effects are headaches, nausea, vomiting, and throat irritation. It's normally 2 puffs twice a day and delivered by a meter dose inhaler, and it's going to be 80 micrograms of budesonide and 4.5 micrograms of formoterol. And it just reduces the inflammation and eases the symptoms of wheezing and shortness of breath and helps maintain asthma symptoms and reduces the risk of asthma exacerbations. Next is the fluticasone and vilanterol. So again, this is a corticosteroid and adrenergic combination. And the brand name for it is Briolipta. The fluticasone inhibits multiple inflammatory cytokines and produces multiple glucocorticoid and mineralocorticoid effects, while the vilanterol relaxes the smooth air muscle. So the indications for this one is COPD and asthma maintenance. The contraindication is asthma and COPD exacerbations. So basically that means if they are having an asthma or COPD episode and are in the ER and can't breathe, they would not reach for this one because it is strictly a maintenance drug. Other contraindications is hypertension and active tuberculosis. The side effects include throat irritation, inflammation, headache, and cough. The dose and frequency is 1 inhalation per day, and it's delivered by a dry powder inhaler, and it's going to be 100 micrograms of fluticasone and 25 micrograms of vilanterol. And this just prevents and controls the asthma and COPD symptoms in